Weird things during doctor's visits. So here's a few things from various doctors, which I think, how come that's happening? How come that's happening? And this is only what's been happening to me. I'm sure you've experienced possibly worse, possibly better. And many of us are experiencing these things. And they're so contradictory. It's like, now you're too old. Now you're too young. Now you're too whatever. So here's a few stories. One story is I'd been to a skin doctor years ago, like really years ago, because I noticed that I was getting those little red spots on the skin, which sometimes elderly people have, and I wasn't sure. What's that? I never had that. Is it something I should be paying attention to? And how could I prevent it? Because it's not that it was really bothering me, but I did not want to be like a sprinkled cupcake suddenly. So I went to see the doctor, a skin doctor, and asked, what can I do? And they just said, it's happening. It's just a normal thing as you get older. Some people have it. It's genetic and it's nothing really which you can do about it, but it's also not that it's a disease or that it's causing any harm. So that's it. So there I was, years ago in my 30s. Suddenly I was belonging to the older people category because I was getting older people like skin symptoms. Okay, then I went to my gynecologist this year, telling her I want hormones. I need hormones because I've been reading about hormones and I thought, I've tried so much and nothing is working. Nothing is working. So these hormones, they've got to be the solution. And it turned out they were, but I didn't know. But I was so desperate. I was just willing to give everything a try. So I was desperate to have hormones. And she asked, no, this is not how it's going to work. First, we need to do the blood test and blah. So we did all kinds of tests. And then she also asked me, do you have a cycle? Is it regular? I said, yes, I have a cycle. Yes, it's regular. Yeah, it's become shorter, but it's regular. I know when it's going to happen. And then she said, yeah, then you don't really need hormone therapy because you're having the cycle. And I said, this is my list. Like, I actually wrote a list and brought it and I typed it down so I wouldn't forget it. And then she said, yeah, okay, maybe we try. But first we need to take blood tests and blah, 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 blah. But finally I did get those hormones. But in her first diagnosis, I was too young. I was in my mid-40s. I was having my periods. I was having them regularly. You're too young. You're not in perimenopause. Like, what? Really? I'm 46. I'm not in perimenopause? Unlikely. Yes, really unlikely. So once I was too old or getting old, there was too young for whatever reasons. And two other ones, I had also seen a nose, throat, and ear doctor because all the stuff happening with my nose and my ear and breathing and getting really bad dark circles under my eyes. It was more than just aesthetics. It was really bothering me and life impeding. I couldn't breathe properly. I couldn't sleep properly. It was aching. It was inflamed. It was just obnoxious. It was so bad. And then she said, yeah, what age are you? You're 46. Yeah, it could be, well, it's aging, it's a process, even, and you have a thin nose, and even if your tissues, if you might be dropping, like you're getting older, everything's dropping, like if your tissues are even dropping like a millimeter, then that can block air and cause these symptoms. So, but it's nothing what we can do. So suddenly I was the old one, like in my mid-40s, my skin and my tissues are dropping, and that's why I'm getting trouble. Side note, now that I'm taking hormones, maybe they have a magical lifting function because the tissues in my nose, the stuff in my ear, the dark circles, I mean, depending how I look into the camera, they're not present anymore, at least not present to the degree they have been. So I don't think hormones, female hormones in a pill or in a gel, have a lifting function to suddenly change a nose and change an ear when that was said to have been the cause for all the trouble. No, it was just imbalances in hormones, which was causing not enough fluidity and blood flow and circulation in those areas, and therefore drying it out from the inside. That's what's been happening. Okay, so I've been too getting old, I've been too young, I've been old enough, and there's another one. And that one really was so bad. I had a surgery 5 years ago, and it was a big surgery at my breast area and had big scars. And I knew that for a while I wouldn't be able to move my shoulders and my arms properly. But once everything was healed in a good stage, I was getting back to walking and moving and doing stuff. And then I noticed that with this arm, this is the furthest, like this was the furthest I can lift my arm. Like a cup from the cupboard, a glass from the cupboard to have a glass of water, I couldn't reach to it. I had to do it with my other arm. So that was really, really weird. And it was that I know I could move that arm. I know I could lift that arm. I was really able to do all these things and with both sides. So I did those. There was never, ever any problem. So I thought it maybe was just an after effect of the surgery, that something was stuck or blocked, or maybe something had been moved during the surgery and it was just in the right place. And then the doctor, he didn't even touch my arm. He did not even touch my shoulder. He looked at it. He said, "Oh yeah, you're over 40. Well, that's just it. It's your age. It's just happening." And I thought, wait, let's look at it. I had a surgery. There are scars. Everything was fine. Just the same day of the surgery, everything was fine. And just post-surgery, suddenly, I'm old. I can't move my arm. No, this can't be. But apparently that was the result I had to deal with and had to live with, because he was not treating me. And I thought, this can't be true. So now I'm suddenly old. I'm too young for perimenopause, apparently. But 5 years ago, I already was too old to have my shoulder treated. So I could move it again. So I could get a glass out of the cupboard or whatever it was. So that was really, really weird. Gladly, I had a friend. He lives in New York and he has a physical therapy office, and he's been practicing for decades and he's a specialist in his field. And I've been living with him for a short while and learning what he'd been doing and his practice and technique. And thanks to that, I had some more of understanding of the body and of the physical, functionality of the body. And I knew that sometimes just stuff is stuck in the armpit. There's so much stuff coming together in the armpit, but when we do a massage, when we rub our shoulders, it's usually all on the outside. It's outside, outside, outside. Rarely anything is done to the armpit. And when he had been treating me, he often just dug his hands into my skin and flesh and really, in a way, like lifted the flesh from the bone. I mean, he didn't tear it off, nothing like that. It was never painful, but I could really sense, ooh, I never sensed that. Okay, so he was really lifting the skin, lifting the flesh, stretching, de-gluing in the way the tissues. And so I thought, maybe, I mean, I can't lift my arm. I can't go beyond this. So maybe I just try. And I lifted and stretched and massaged my armpit. And then slowly, I mean, you see it. I can lift my arms. I can do everything with my arms. I can roll it. I can hang on a bar and everything's back. Actually, everything's back to better than it was. So, no, I wasn't too old. I wasn't too old, but the doctor said I was. And if I hadn't found solutions, if I hadn't done the research, if I hadn't been gifted with having that friend and learning from him, I would be stuck with a stuck arm. So if doctors are telling you, you're too young, you're getting old, you're just too old, that's just life, you might accept it, and it might be the truth in some cases. I mean, my white hair, I just got to accept that it's getting white. I just can't, there's nothing I can tell my hair to, now you're going to grow back and be darkish brown. It's not going to happen. So I accept that. But in many cases, there's no need to accept it, at least no need to accept it just yet. And why I'm sharing it with you, because I imagine that you've been going through similar things, that you've been told similar stories, and that you're too young, you're too old, you're too this, you're too blah, 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 blah. You're always something, but you're totally okay. You're totally okay. And you deserve to be treated, and you deserve to get the help and the support which you're needing. And many of the perimenopausal symptoms, they appear somewhere completely different from our ovary or uterus or sexual organs. They are noticed in other parts of our body. They are noticed in how we see life, how we go through life or not go through life. They're in our psyche. They are everywhere. And you're not wrong. You're not at fault noticing these changes. It's rather so good that you notice the changes. And if the doctors are not listening to you, I encourage you, find other doctors. Really find other doctors and find a community of other women sharing their experiences and what has helped. Because you don't need to go through this alone. It's so bad and so sad that so many women had to go through this alone, still are going through this alone, and are thinking that it's their fault, that it's their decision to suddenly not be who they are anymore. It's just not. So take good care, be kind to yourself, and find people and healthcare practitioners who are kind to you as well. See you next time.